Good afternoon, everybody. It's my pleasure to welcome you to the VIVACY Symposium. Today we're going to be talking about decoding Asian facial aging and precision-led structural strategies using the stylage line. I'm Dr. Renita Alawalia. I'm a dermatologist from Toronto, Canada, and it's my first time at MCAS Asia and my first time in Bangkok. And my two co-speakers really need no introduction. They are the stars of this show. Dr. Paizan, who is a leading cosmetic surgeon from Thailand and instrumental in organizing this event, and Dr. Sui, a world-renowned plastic surgeon from China, also on the board for this event. But I will tell you guys, I have a lot of experience working with plastic surgeons. My brother is a plastic surgeon, my husband is a plastic surgeon. So if these guys get too heated, I have a lifetime worth of training in keeping surgeons in line. So this is our agenda for today. I'll set the stage for the approach to Asian aging. Dr. Paizan will then go through some of the biological pathways with a deeper dive. We'll do some cases using L, XL, and XXL. And in China, there's only L available, so we'll go through cases using L for full face rejuvenation. And then hopefully there'll be some time for discussion. So let's set the stage. So this was an interesting study that was published in the International Journal of Cosmetic Science a couple years ago. And participants looked at photos of women in different age groups across different ethnicities. And they were told to put those women into a defined age group. And across the board, the participants were accurate in identifying which age group the women fit into. But when they were asked to say what features led them to believe that, the results of what they thought were different. So for the Caucasian face, the first things they noticed were wrinkling, volume loss, and photoactinic changes. And across all the other races, the first thing they actually noticed was pigmentary dysfunction. And in Asian faces in particular, heaviness and sagging of the lower face over time and flattening of the midface along with those pigmentation issues were leading. So why is this? And we're going to do a deeper dive of this later. But one of the key factors is dermal thickness. Asian skin has a thicker dermis, and this helps with slower collagen loss, and that higher melanin content contributes to increased pigmentary disorders such as lentigines and melasma. It's also important to take into consideration facial structure and bone remodeling. So baseline information about skeletal structure, such as a wider bizygomatic width, such as a broader gonial angle, all are things that need to be taken into consideration when thinking of how to restructure a face. And the stylage range offers a complete texture palette to do this. And what makes it unique are three unique features. So one is the IPN-like technology, where you actually have two unique matrices that are joined together almost like magnets without extra BDDE to create a very homogeneous gel that's easy to inject. Mannitol is the other difference, which is a potent antioxidant and free radical scavenger. And the syringe design is designed for a unique great comfort and precision because of its ergonomics. Now, in different parts of the world, we have access to different ranges of this line. In Canada, we have from S to XXL. And I hear here in Thailand, we have lips and the skin quality line. And in China, there's just L. And so to be able to use the tools that you have to give your patients the outcome you want in terms of restructuring is important. So let's just take a closer look at that IPN-like technology for a moment. So you have two matrices. Matrix A gives shape and structure, and matrix B gives flexibility. And instead of them being cross-linked with more BDDE, they're actually interpenetrated networks, which creates a dense and flexible gel with properties that allow dynamic movement. And today we're talking about structure. So we're going to focus on L for enhancing, XL for remodeling, and XXL for restructuring. So I'm going to hand it over now to Dr. Paisan, who is going to go through for us some of the biological changes in the Asian face.
Good afternoon. Thank you, Dr. Renita, for the first overview of the VIVACY products for the facial filling, contouring, structuring. First of all, I would like to thank Philippe, VIVACY company, for bringing the products into Asia. It's quite new for us, but we have already done VIVACY for almost 20 years in France, in all over Europe. For Thai, we are not still, a little limited because the product is on the way, but we have the 3 SKU approved for use. It's the Hydromax for hydration, and Lip and Lip Plus. For China, Dr. Gui will clarify to us the Stylish L, just only one. But I think in the very near future, we will have all 7 SKU of the VIVACY coming into Asia. I would like to lay a little basic of the wrinklings, contour, beyond wrinkles, understanding biological aging pathway in ASEAN skin. As we know, all the anatomy of the facial structure, we have 5 layers, starting from skin, subcutaneous tissue, musculoaponeurotic layers, and retaining ligament down to the bone. And now we are concerning more on the subdermal area, subsmart area, and also subperiosteal area, that we place our fillers in that particular area. For the biological aging changes of the face, we have starting with the skin laxity, loose skin, loss of resilience. Secondly, facial lipoatrophy, loss of the facial fat. Third, smart and retaining ligament laxity. 4, facial muscle aging and hypercontraction that cause the wrinkles. And lastly is the bony resorption. We will start with the number 1, wrinkles. And for the Asian face, we have the wrinkles. Second is the pigmentary changes with our major problem. And the loss of the subcutaneous fat, the change of the facial musculature, and also loss of elasticity of the skin. Lastly is the changing in the underlying of the cartilage and bone. So take a look at this lady. She is about 55 years old, at the same age as me when I was in Tibet. But you can see the face wrinkling severely, drooping, photo damage of the skin, because in Tibet it's up very high altitude, and they're exposed to the high concentration of the ultraviolet. So the severity of the photoaging is much more dramatic. So we're starting with the biological photoaging with the wrinkles. We have 5 types of the, sorry, I need to have my glass. We have the 5 types of the can you expand the 5 types, 4 types of the wrinkles. Starting from the type 1, for the young patients, 25 years old, almost no wrinkles. For the type 2, we have the dynamic wrinkles. And the third type is the static wrinkles. We have to have the wrinkles at all times. And the type 4 is the wrinkles entire face. So this is 4 categories of the Krakow types of the skin wrinkling. Characteristics of the Asian skin, as Retina first mentioned. We have the high melanin content, thick dermis comparing with the Caucasian skin, high sebum production and contents, less wrinkling compared with the same age, like a 40. We can see more wrinkles on the Caucasian types of the skin. So the skin key quality changes in Asian skin. Number 1 is a pigmentation predominance. The hallmarks of Asian aging is irregular pigmentation, including solar lentigine, melasma, mottling hyperpigmentation, which often appear before and significantly before the wrinkles formation. Skin tone and yellowness as Asian skin. We have a notable decrease in skin reflection, the resilience of the skin, and increase in overall the color yellowness that often observed at the peak of around age up to 60 years old. Pre-aging phenomenon. So younger skin report early signs of aging such as the dullness and uneven skin tone, dryness, that Hydromax might come into play for this part of the skin, transient wrinklings and lack of firmness. And lastly is the skin texture, the surface roughness, and along with the enlargement of the pores. We have the delay wrinkling, not so fast as our western side of the skin, and sagging, volume loss. Preorbital aging, we have the increased shadowing under the eyes, increased protrusion of the lower eye fat pad or lower eye bag, and predominant clavicles are common. Mid-face sagging, this is the most significant changes in skin elasticity occur in the cheek and lower eyelid. Body resorption, this is the last factors at age our face involving the bone resorption, especially in the mandible, maxilla, and also the preform area. Of course, the maxilla resulting in the loss of the definitions of the lower face. For the pigmentation, it's quite obvious for us that the pathway of the melanin starting from the tyrosine and metabolized into the 2 types of the eumelanin and pheomelanins. The common etiology of our melasma, number 1, hyperfunctioning of the melanocyte, and secondly, we are going into the dermal extracellular matrix abnormality, which is a solar elastosis. Basement membrane disruption for increased vascularity, increase the activity of the mast cells, and also fibroblast activity. So it's coming from one cell, what we might know is the mast cell. So mast cell release the histamine and come down to the epidermal pigmentation, ECM abnormalities, and hypervascularization. So that in the end is an advocate to the melasma. This is our patient skin. The melasma is here. You can see the patchy, brown, demarcated hyperpigmenting spot on the mid-face. See more obvious on the side. For this is a deeper, we call the dermal type of the melasma. It's a dermal pigmentation that may require the other laser treatment. Now the factors, okay, this high melanin content are going down. The loss of facial fat. This is my first batch experiences for the Hydromax that the company bring it to me to try last year. We use the Hydromax for 2 ml on the sides of the face, and Stilage as for the tear trough area, or we call it the lid cheek junction. And another 2 ml for Stilage L for the nasolabial fold. And you can see This is a before and after. The eye contour, the cerebral palm up, the quality of the skin, also the submalar area. That look quite nice. The gel is also easily to inject to control the volume to put into the skin. Fillers nowadays, in terms of the technique, we have to pay more concentration because if you push too much, then it will cause the lump or some overfill syndrome. So we use a little bit less of the amount of the fillers. And of course, now we are happy going on more to the Hydromax for the hydration, for the growing of the skin, or even we call it glassy skin. You can put 2 or 1 to 2 ml on each side of the face and create the beautiful skin by the Hydromax. In terms of the volume, as Dr. Lenita said, we have the SML, XL, XXL that we can choose more particular area, levels of the placement. So this is the patient. We can see the sunken of the anterior projection of the cheek. And this is after the treatment. You see, we can feel 1 or 2 ml and create the projection quite nicely. But how to create it? We tend to do going dive down, deeper. We are not putting into the subcu compartment anymore. We're putting deeper down to the bone to create the contour of the bone. This is again on that side. You see this depression of the mid-cheek and also the under eye area. So for the lid cheek junction is where is the place that's quite difficult. We have to put the fillers, the L, down to the soup or even close to the perosteal area to pump up because as you can see, this is a young, and for the aging, the orbital retaining ligament, ORL, tend to lax. And the orbital fat push down and create that eye bag or the tear trough area. For the superficial subcutaneous fat of the face, the implication in the aging process, of course, there's an absorption. Volume loss appear to occur at different rates in different compartments, leading to irregularities in facial contour, loss of the seamless, smooth transition between the convexity, concavity of the face associated with the use and beauty. So we are concentrating more on the deep fat compartment that we will fill the fillers. We might use less amount of the fillers, but create the more contour and projections of the face. So under the SMART plane, posteriorly to the mimetic muscles, reach and adhere to the perosteal plane. We have the medial soup, lateral soup, and also deep cheek fat compartment, and also buccal fat pad. On Monday, we have the big cadaver dissection at LABORATOIRES that Dr. Frank, Constantine Frank, me and Dr. Gui will conduct the soft cadaver. We can accommodate about hundreds of the participants for that Monday that we can see the deep fat compartment, what it looks like. Musculature, I will not concentrate much because this is a movement, and of course the treatment is by botulinum toxin mainly. So for the eyebrow, for the forehead line, for the frown line, for the crab feet. And this is after the treatment. You see the lines is gone, but maybe a little at the side, lateral side of the face. Number 5, inherited loss of elasticity. Of course, we know the retaining ligament laxity. We know the true ligament and false retaining ligament. So the main one should be the true retaining ligament that's starting from the bone to the dermis. But the other that structure, the retaining ligament structures, and also the content in the dermis, there's a main component is the collagen, and the function of the collagen that maintain the skin quality. There are at least 28 types so far of the collagens in the skin. Type 1, approximately 90% on the skin. Type 2 is the cartilage. And we have the type 3, 1 and 3. And number 4, 5, more on the skin surface. As you know, the structure of the collagen mainly is the containing amino acid. We have the hydroxyproline, glycine. That's all the structure that amino acid combining and forming the helix, the triple helix, and bunching into big fibers. And also, elastin is one important factor now. Elastin is produced by fibroblasts and rich in glycine, proline, and lysine, forming elastic fibers with an insoluble core surrounded by microfibrillar protein. The function provides resilience to the tissue under constant mechanical stress, including the skin, or the lung skin. Elasticity, the act of the biological spring, stretching multiple times in length and recoiling without energy loss. Aging and damage. So elastin fiber is mainly developmental and minimal in adulthood. Damage from the elastase, UV exposure, or smoking is a poorly repaired, leading to the function loss and decline of the elastic fibers. Degradation, progressive loss of the elastin reduces skin elasticity, contributing to the skin aging. So this is a key amino acid in the elastin. I won't go too much into that. And of course, we have the intrinsic and extrinsic aging. For the histological matters, we have the epidermal thinning. For the extensive, we have more on the solar elastosis. The clinical features, we see the dryness, cirrhosis of the skin. And for the extrinsic, we add more on the dyspigmentation because of the exposures of the ultraviolet. Lastly, the changes in the key skeleton change in changes in aging, facial aging. Of course, we have the mid-face change, maxilla and canine fossa bone resorption, leading to the reduce of the cheek projection and loss of the mid-face support. So you see the eye bag and the lid-cheek junction drooping easily because of this maxilla resorption. Orbital rim, the bone expansion, contributing to the hollowing and also the hollowing of the eye and tear trough. Piriform aperture widening due to the resorption of the deepened nasolabial fold. Mandible and the lower face recession, so the jaw remodeling, reduce the definition and create a more square kind of face. Lastly, it's a unique characteristic. It's an Asian facial skeleton typically start with this flatter and wider mid-face. Despite lateral onset, soft tissue aging, bone loss become prominent in the 40, 50 years old and diving structural changes. So this is a key aging, number one, the widening of the orbital rim and progressive volume loss and remodeling of the mid-face, particularly in the maxilla area, and also resorption of the mandible. So this is a case that we put some fillers a little bit more on for the nasolabial fold. So lastly, consequences of skeleton changes, the collapse of the face, soft tissue shrift, and outer facial proportion, accelerated aging. We have the sexist differences for the bone changes generally started early in the woman, more on comparing with men. Permanent changes, while the soft tissue can be lifted. the bone remodeling is a key structure for the irreversible changes that reduce the support of the face. However, for the bony resorption, now we can restructure it with the XXL down to the bone, like to the chin area, or even to the temple, to the mandibular angles, to create the more contour and more projections of the face. This is my first visit to the factories in France. Beautiful, I mean, not beautiful, sophisticated. And the syringe is new. We solved that later. Dr. Renita or Dr. Gui will show us for the very beautiful, very ergonomic use of the syringe. Thank you for your attention.
Thank you for that layer-by-layer overview. It was very comprehensive. So now I'm going to explore with you rebuilding the framework through the decades with 3 case examples of patients from my practice. And when I think about rebuilding the framework, I often think of this type of photo, which really illustrates the ligaments of the face, from the superior temporal septum to the inferior temporal septum, and then our retaining ligaments all the way down to the mandibular ligament. And what the significance of this line is it separates our immobile face from our mobile face. And I always find it to be a very useful way to naturally create a lifted appearance without adding a lot of volume to the face. And I think that comes in handy for the Asian patient. So when we look at the line of ligaments, we have the actual line of ligaments, and then we have what is a functional line of ligaments. And the two are a little bit different. And if we can keep our injections to create a lifted, non-volumized appearance behind this functional line, we can really achieve a nice result in our patients without creating a wider look. So just to illustrate this a little bit more, the blue arrow shows the zygomatic ligament, and the white stars mark the masseteric ligaments. And that pink dotted line represents the functional ligament line. So I apply that principle when looking at patients of all ages and all ethnicities, especially when we want to create a lifted, more sculpted look without adding a lot of volume and without changing someone's unique features. So I'm going to show you first a case of a young woman in my practice. This is Grace. She's a beautiful young lady. She's in her late 20s, but she feels like she looks like a baby. And she wants to create more definition in her face. She's bothered in particular by her chin, but also her jawline. And she wants a little bit of a nasal bridge. And she also doesn't want anybody to know that she's had anything done. So when I looked at Grace, this is the plan that I made for her. So what I like to do in the temples, I really love stylage L over here. And actually, it's more an injection between the superior and inferior temple septums to create something that I call a sneaky lift. So small boluses between the two septum per side to create a really nice, subtle lift. For her gonial angle, I want to mimic bone, so I choose XXL. And I do small boluses at the angle. And then for the jawline, along the mandible and towards the platysma-auricular fascia, I prefer XL because I can inject it a little more superficially, and it creates a lot of natural movement and a nice lift. And I did 0.5 per side. So after injecting the lateral face, I moved to her mid-face. And very carefully and with a very small amount of volume, and with XXL for the nose, only a very small amount of volume is needed, which helps me in my in terms of safety in this area. So 2 small boluses to create a little bit of structure there. Now, the chin is another area which needs a lot of caution. You can remember from the photo, Grace does have a little bit of a recessed chin, and she is bothered by it. So over the course of 2 sessions, we used XXL, and we injected both the pogonian to give her projection and to the mentum. And the reason I like to do 2 sessions is because you don't want to put too much volume in the chin in one session, because sometimes if you over-volumize that area, there's been cases where you can see some bony reabsorption in that area due to the pressure and swelling. So using 2 sessions, I feel will prevent that. And this is Grace's after result. So she still looks like her, but she is a little bit more refined and defined, and her face is a little more balanced. And here's the before and after together with our treatment plan. I actually also added 5 units of toxin to lift the tip of her nose as well too, just to complete the look. And so we did 4 cc's total in her for a very natural, subtle enhancement. My next patient is in her mid-40s. So this is a patient who has never had any treatments done before, a beautiful patient, very nice proportions to her face, but starting to notice those signs that we've been talking about. Starting to notice pigmentation changes, starting to notice some sagging, and just doesn't really feel like herself anymore. And again, and I don't know if this is just a Canadian thing, but all my patients say, I don't want anyone to know that I did anything. And actually, this patient doesn't need a lot of changes, just a little bit of refinement so we can get ahead of some of those age-related features. And again, she has nice facial width, so we don't want to increase that. So again, I did the technique with L between the superior and inferior temple septum, small boluses, just 0.5 per side. I did deep bolus injections at her gonial angle to enhance her jawline. And then I did another injection that always makes me hold my breath, but gives a really nice projection to the midface, and that's injecting the piriform fossa. So we carefully did that for her as well, 2 to each side. And this is her after result. And her treatment plan along with her before and afters. So you can see her face appears lifted, not any increased volume, and the piriform fossa and the nasolabial fold is softer with a little bit of projection. Now, the more difficult cases are often older patients who haven't had treatments before. And this is actually one of my nurse's patients. She's a Filipino, one of my nurse's mothers. She's a Filipino descent, has never had any treatments done before, but my nurse brought her in saying, okay, now's your chance. Dr. Renita needs models for MCAS. So she was really excited because she's an extremely happy lady, and she really wanted her outside to match her inside again. And I showed both sides of her jaw here because she was really bothered, actually. That was one of the things that bothered her the most, was the asymmetry between her jawline that she's had forever, but has been getting worse with time. And the other thing that she pointed out, she said, my head is turning into a peanut, which not a lot of patients articulate, but it's sometimes the phrase we use for when there is a lot of hollowing in the temples. So she wanted to address that and to address some of the sagging. So this is the treatment plan that we developed for her, again using L, XL, and XXL. So for her temples and hairline, I did a different technique because she needed volumization in the temples. So from an entry point in the zygomatic arch, I used a fanning technique and did 1 cc per side to smooth out the area. And although we have to be careful with the lateral cheek, after I did the temple, I noticed that there was still a little laxity in that area. So staying behind the line of ligaments, I did small boluses to create a little lift there. I next moved to the gonial angle and bolused with XXL. And then for the right jawline, we used the cannula along the mandibular border, needing a little bit more product than what we did on the left jawline to create a nice contour. And then I finally did a small vertical lift for each side of the face using XL to create more lift. And she had a nice result in terms of creating a slimmer and lifted appearance with a more defined jawline. The other thing that I did for her was I added a few units of toxin in the ligaments, like behind the line of ligaments, into those little muscle fibers. And I also find that that slims and lifts a little bit too. So she was very happy with her new jawline and a lifted appearance of her face. So by using those principles of lifting behind the line of ligaments to start and then refining, we can create a lot of structural change that is meaningful yet subtle and preserving someone's natural identity and natural features. So those are my 3 cases, and now I will hand over the stage for an exploration of L for full face rejuvenation.
Thank you so much, Dr. Renita. So next, Dr. Gui will give us the talk. Please, yes. His topic is the one product, the full strategy, optimizing Stellage L for Asian full face rejuvenation. So please give a hand to Dr. Gui.
Dear Dr. Benson, dear Dr. Renita, and dear Mr. Philip, dear colleagues, good afternoon. Okay. Can you help me? The candle? Please.
Restart that. Stand up.
Okay. No, this?
Yes.
Okay. I'm Dr. Haiyan Cui from Shanghai, Tongji Hospital, Tongji University. It's my pleasure. I'm so happy to stand here and with all of you and spend 1 hour to talk about VIVACY. I know VIVACY many years ago. Many years ago in Paris, and Dr. Benjamin Escher introduced VIVACY to me. He asked me to help VIVACY enter into China market. Long time. Today, VIVACY and Dr. Benjamin Escher's wish has come true. Yeah, VIVACY cooperation with Shanghai Pharma. And VIVACY and the Shanghai Pharma, very, very big company. I really believe that in the future, VIVACY and the serious product in the China market will increase rapidly. Congratulations. And I want to say, this Incas Asia have a great success. Dr. Pansan and his team did a great job. A big applause for Dr. Pansan. Okay. Back to my topic. We know aesthetic medicine, we should remember the definition. The aesthetic medicine includes 3 pillars. The first is definition. The second is the aesthetic assessment. The third, the pillar, The third pillar is solution. It's very simple. Aesthetic medicine just include three pillars. We know these three pillars, we will master aesthetic medicine. We know aesthetic medicine is discipline grounded in the modern medical paradigm that employs aesthetic assessment and holistic design with multimodal approaches to enhance youth, beauty, positivity, and well-being, health, and longevity. It is artistic creation with medical boundaries, discovering and cultivating each individual's inherent nature and vibrant beauty. It represents the pinnacle of quality living and the crown jewel of medicine. We should remember this, the definition. It's philosophy. Philosophy is the direction of aesthetic medicine. It's very, very useful. And the second, how to give the patient a facial assessment. According to my experience and the clinical practice and the training, the experience, I summed up the simple method is feature codes. Feature codes, the child consist of Chinese two characters, 未来. 未来 translated in English is have a good meaning, it's a good wish. Use Chinese two character 未来 to give the patient assessment and the injection method. It's very simple. You know, this assessment method from forehead, nose, lip, and chin. This straight line, middle line is very, very important. This middle line determined the ratios, the length and width, the ratios, and determine the two sides, the balance and symmetry, and determine the light and shadow. So this middle line is very important. And the second horizontal line from temple hollow, eyebrow, and glabellar complex is a horizontal line. And the second horizontal line from the cheekbone here. And plus the nasal labial left and right, this is Chinese called wing. And plus 2-point tear trough, Chinese called lai, 未来 means future. Just use a simple method to give the patient assessment. It's very effective. And the third pillar is solution. Solution, I sum up just 5 words. How to augmentation, how to reduction, how to tightening, and how to brightening, how to elasticity. Yeah, just 5 words. These 5 words and support our philosophy, support our assessment, and help us to create artistic work. Back to our product. We know VIVACY. VIVACY is a great company. Stellage is a good product. We know atrial filler is important. The method support aesthetic medicine is very, very important. Cannot anything product can replace atrial filler. It's atrial filler the values for aesthetic medicine. There is no any method, include ABD, include the biostimulate, include the stem cells, cannot replace atrial fillers, the value. So, the stellage is a good atrial field. It supports we to want to the goal. And this field has a special several features. We know this product has a special patent about the cross-link. The dual chemical cross-linker and plus the physical entanglement. It's a special technology. This special technology support the stellage has outstanding the cohesive force. This cohesive force support this product, give our perfect outcome. You know, this product injection, after injection you cannot find the swollen because have the mannitol. And the injection there, it cannot migration. It's so-called what you want, what you see is what you get. It's a good product. Okay? Let me show a video. Just 2 days ago, before from to Shanghai, come to Bangkok, I take this video. Yeah, I have injecting a patient. Let me show. Before we injection, we give this patient assessment and use the feature codes. It's very simple. This patient, the head shape is too long. The long and the length and the width is not a good ratio. Okay. How to give the good ratio and the, before injection, we use 1% lidocaine. Yeah, give the anesthesia. After the local anesthesia and the injection according to our future codes injection. Augmentation, the nose, the root of nose, bridge of nose, and tip of nose. Yeah, it's shape very good. It's very simple, and the injection very smooth. Glabellar complex and injection, and the touch bone, and the withdraw no blood, and the slowly push and the massage. And we want to have a good chin shape. Because this patient, the chin is not symmetry. And because the head shape is too long. And injection here, and augmentation in the eyebrow. It can shape the eyebrow, the shape, and eyebrow lift a little. Injection subcutaneous. We know in here, glabellar complex have important vascular. We should avoid this important vascular. we find the oral outside 1 cm as an entry point. It can create nasal labial fold, and this region, Chinese called 苹果肌, and it can reach the tear trough. Just one entry point, we can reach our goals. You can see the cannula can reach the tear trough. Just release a little. We want to become the assessment very easy. We want to become the injection very easy. We just use this entry point and to shape the middle face and the lower face.
Dr. Gui, for this direction, do you go close to the bone or above into the superficial fat compartment?
Yeah.
The cannula go deep.
Just subcutaneous. I think this space, this layer is very safe. Maybe next the safe layer is the periosteum.
And of course, you are using the cannula number 22, right? Cannula
23.
23.
Yeah, cannula 23.
Quite nice, huh?
This cannula, it can reach the middle face and lower face, almost the middle face and the lower face. It can create the chin and not symmetry, and it can to the jawline and shape the good jawline, and it can reach the tear trough and the how to create the cheekbone and the buccal, this area, and the temple hollow is just a little the atrial filler, touch bone, and withdraw no blood, and slowly push and massage. Yeah.
So it seems like you use one single entry point, and then you can go around the face from nasolabial fold to the soup and also to the lateral side of the face. And then you change to the needle for the temples area. Right?
Yeah. Sharp needle.
Gunshot.
Yeah.
And above the brow here, the orbital rim.
Yeah.
Very nice.
Okay.
And
Thank you.
What was the total volume that you used for her face of L approximately?
How much?
How many ml?
7?
7.
Yeah, just 7, the full face.
And how much underneath the eyes with L?
What?
Like for the tear trough?
A tear trough maybe one tear trough maybe 1.2.
Okay.
1.2 or 1.1. Oh, no, 0.2.
Yeah, 0.2.
0. Sorry.
And how did you like L in the tear trough if you're just placing it like on the orbital rim with the cannula?
Maybe a little in the subcutaneous and maybe some in the septum. Yeah, in the septum.
Great result.
Okay, thank you.
Thank you very much. Do we have any questions from the floor?
I have some questions if there aren't any from the floor. So what do you guys think? Historically, have we applied too many Caucasian aging concepts to Asian patients?
Pardon me?
Do you think that, we've applied Caucasian aging concepts to Asian patients historically, and how are we now moving away from that?
We start with the shape of the face. For the Asian face, we have the more broader face. The center is a flattening. Comparing with the Caucasian face, it's more like a volleyball, so more protruded, and also the prominent and the high projection. But from the Asian side, we put the fillers more on the nose before to have the nose projection, forehead, and the chin. That is a three area that we put. For the Asian, we have the high malar bone, malar cheek prominence, comparing with the Caucasian. So for the malar, we have to escape from it. Like we put the fillers more on the temple to enhance the temple and submalar area, just to blend the malar prominent that make it look not so prominent. And number three, of course, we have the chin and lips. Lips before 15 years ago, we don't have any lips for Asia. Because Asia, when we take a look at the lady, they say, we look at the nose. But for the European look, they say you look at the lips. So in Asia, we more put on the nose and the forehead. But nowadays, we shift to the more on the lips because some, the model, movie stars, they doing more on the lips. So lip is quite a emerging market for us for these last 3 years. You have all the kiss lips, lip plus that we have in the market. So it's more particular for the lips area. And for the lips, as I learned from VIVACY, we have two batch. One is the normal, you just make it like a sausage shape, the whole band of the lips. But for the lip plus, it's more concentration of the head shape. So you can produce a kind of, we call the Asian lip or the Korean lip, that we have like a cherry on 3 or 4 spots on the lips in order to enhance the shape, which is different from the I don't know, in the Caucasian side. So this is how I perceive the fillers until now. How about you, Dr. Good?
I have 70 Caucasian facelift experience. According to my experience, we know the Caucasian people, the dissection is very easy because the skin and the subcutaneous and the different layer connect is loose. It's not tightening like the Asian. When we dissection different layers, it's very easy, no bleeding. But for Asian people, when we dissection different layers, it's many bleeding because the Asian people, different layers, very tightening. It's first. The second, the Caucasian people, the skin is very thin. But Asian people, the skin is very thick. Yeah, very thick. So, for Caucasian people, when they get 40 years old, 35 years old, they easily become old, become the skin loose. But for Asian people, you can see when they over 40 years or 45 years old, they look very young, very tight. So, Caucasian people and Asian people have the common features. These common features, according to the formal aesthetic, include the symmetry, balance. It's common. For different people, it's common. But for Caucasian people, need the volume and need facelift. But for Asian people, the first is the contour shape. Is first selection. Thank you.
Thank you. Thank you both so much, and thank you to VIVACY for sponsoring this wonderful symposium.
Any questions for the floor? I saw that. No. So for Danita, from your area, which is you are from Toronto, more on the Caucasian or the mixed community. So how do you do? Because the lady we saw from your case is Asian. Look.
Yeah, so all of those patients were Asian patients. In Toronto, we have a very diverse population. So we see, 50% of the population is visible minority, so we see everybody. And I think a lot of what you both were saying resonates with me. It really comes down to the individual assessment. And there are certain cultural preferences and all the things we've talked about today in terms of structural features we take into consideration. But it really comes down to evaluating each patient as a whole and a 360-degree approach to the different layers of their face and their goals for rejuvenation. And I think if you apply those principles and treat everyone uniquely with awareness of cultural preferences and beauty standards, that's how you achieve the best natural outcomes. And I think, I feel lucky that I live in a city where I get to treat every race every day.
As Ladita said, for the fillers assessment, we have to personalize or customize to each of the patients depending on sex, age, and for me, occupation. I have one patient from Pattaya, is a transvestite, and she came to me with only the lips. And I put in her 3 ml. A month later, she came back to me again. She said she wants it more. I said, wow, that look a bit weird, look too much. And she said, please put it in. Because when she danced on the floor, on the stage, and the people look at her like far away, she needs to be the first one to be recognized on the stage. But when we look at closely, or 1 meter away, wow, it's like something overfilled. So in terms of this, we have to be more careful, as Ladita says, the beauty concept changing. In Thai, we have the sex change from man into lady. Or even now, we have the lady into man. So I have some case with the lady into man. She came to me with the jaw. I have to put like a 2 ml on each side to blotting the face. And the new concept of the beauty, the world beauty contest, the lady who got the first is from Africa that year. So the lady now, they wants more on the blonde kind of style, not like a Korean style small face anymore. So the concept of the beauty also keep changing. So we have to ask our patients directly what do they want. That's it for me.
Okay, good.
So I think we ran over the time. Do we have any further questions on the floor?
Oh, there's a question.
Please.
Yeah, I actually learned that from a mentor in Brazil. I never knew about that before, but there are these fibers that help support the retaining ligaments. And in someone who has a wider face, you can inject a few units of Botox. I do a 2-to-1 dilution, typically 8 units, and it creates a nice slimming and lifting effect in the right face. They have to have a wide face, and sometimes when they smile, you can almost pinch that extra. It's not a muscle; it's like just those fibers. You can pinch it, and I think you might know the faces I'm talking about. And if you inject a few units there, it has a nice effect.
Dr. Gui has
Okay,
comment.
thank you. I just said a sentence. Many Chinese doctors from China come to Bangkok. Yeah, they have many experience about the injection. I suggest, Philip, maybe you can supply about a platform, give them more chance, and they will give you a surprise next time. Thank you.
Thank you. So we should have more SKU of the Stellage coming to the Asia, to all parts of the Asia. And we suppose that any country will have their own design, the shape, and enhance the safety markets also for our patients. So I think we ran out of time. Thank you so much for our audience and Renita and Dr. Gui. So thank you very much.
Thank you.